sure we have a little bit of time for discussion before she gets here. But as Beth mentioned, I'm Kara Boulahanis, and I'm the Community Engagement and Wellness Specialist on the Safe and Inclusive Schools team here at ODE. And we, on the Safe and Inclusive Schools team, are kind of a connector hub to help support a lot of different efforts that are occurring across our agency, but in particular, the integrated model of mental health that you guys already you already had the opportunity to hear about from Grace, my colleague. And so this work that we're going to talk about today is kind of the more practical application of that integrated model of mental health work. And it is nascent. We are just wading into this. As I'm sure most of you know, when Addie's Act was passed, Oregon was one of 4 states that did not require a suicide prevention, intervention, and postvention plan for schools. And so we are trying to take the best practices across the state or across the nation and help support that implementation, while also simultaneously recognizing that suicide prevention as a field has been very dominant culture, and ensuring that our implementation of our suicide prevention, postvention, and intervention planning is culturally responsive and equity centered has been a huge piece of the work that we're trying to do here. So I'm going to be sharing with you the beginning stages of everything that's going on right now, because we are in the first year of implementation. And then I really am hoping to hear from you guys, how can we shift and grow as we're moving forward to create supports and materials that are really actually supportive of the field and on the ground, as you're starting to see what is happening as people are developing plans, what are the challenges, what are the opportunities, and how can we at ODE really help support you in addressing those challenges and opportunities. So first, I'm going to just give a little bit of an overview about what legislation kind of lays the groundwork for the work that we are doing here today. You guys might all already know this, but I know for me, it was very helpful when I first started here to see kind of why the money flows the way it does and why certain things are supported the way that they are. And it almost always goes back to what legislation has been passed to support these initiatives. So the first piece of legislation that we're talking about today is the one that Beth mentioned, which is Senate Bill 52, or Addie's Act. And so Addie's Act was named after Addie Staub, who's a young transgender woman in Oregon who died by suicide in 2017. And Basic Rights Oregon, the statewide LGBTQ advocacy group, worked with Addie's family to develop and introduce Addie's Act in the legislature, and they've remained involved in our planning and process as we go along. So that is why when we reference Senate Bill 52, we call it Addie's Act in honor of Addie Staub and her family and their efforts on behalf of Oregon's children and families. And so Senate Bill 52, as I mentioned, was we were one of 4 states that did not have this type of requirement, and now we do. And we require school districts to adopt a suicide prevention, intervention, and postvention policy and plan. The law calls out that those plans must include procedural planning, so, who calls whom when kind of stuff, but then also equity and racial equity centered supports, recognizing that suicidality impacts different communities in different ways, largely based on identity experiences of oppression. And so there are specific groups that are called out in the legislation that we need to provide supports for. So students experiencing houselessness, students who are in foster care, students who are bereaved by suicide, students who are gender or racial or sexual minorities, all of these groups that have increased rates of suicidality based on the oppression inherent within our culture. And so this requires that our plans address those unique needs. And then also a staff training process that explicitly addresses when and how students and families are referred to appropriate mental health and crisis services. So how can we go about ensuring that our system is designed when a student reaches out with a difficulty or a family reaches out with a challenge, that they are getting connected to those resources that we are building, and ensuring that all of our staff, not just necessarily the staff that is focused on mental health, are capable of ensuring that those referrals are made in an appropriate manner. So then the other piece of legislation that that suicide prevention, intervention, and postvention work comes under is the school safety and prevention system, which is Section 36 of the Student Success Act. And so Section 36 of the Student Success Act is designed to develop a system that will address the supports that all students require for safety. And so the idea is that safety is for all students to belong, and that suicide prevention and student wellness are key to ensuring that students are able to belong in their schools. They are not the only aspect. Obviously, we need school culture and climate, equity-centered social emotional learning, and also high-quality behavioral safety assessment as well. But so Section 36 of the SSA is funded, whereas Addie's Act Senate Bill 52 was not funded. Both of these pieces of legislation were passed in the same year. So ODE took the opportunity to recognize that Section 36 of the SSA requires the focus on suicide prevention and intervention, and had funding to support those needs. And so we connected Addie's Act and the supports that we're providing to Addie's Act to Section 36 of the SSA and the school safety and prevention system in order to be able to provide funding supports for these very important efforts that were previously unfunded. So currently underway is that we have 16 different positions that are being supported through the Section 36 school safety and prevention system. And so that's 11 ESD based school safety and prevention specialists, and then 5 Lines for Life staff positions. And so I'm going to talk a little bit about what each of those are here. So the school safety and prevention system is set up as a regional structure, and you'll see here that in different ESDs, and then within those ESDs there are networks of support so that every region is covered. So for example, ESD is paired to cover Lane ESD as well, so that we cover that entire Southwest region. So in that way, we are training these 11 specialists in a comprehensive set of suicide prevention, intervention, and postvention measures in school climate and culture, including the Every Student Belongs rule, as well as in behavioral safety assessment, so that these individuals are available essentially as taken the time and energy to train these individuals in our equity stance, in the best practices in suicide prevention, postvention, and intervention, so that they can help at the district level with the implementation of these supports. So these individuals are available to help connect you with the resources that the state has, as well as help connect you with the resources that exist within your community. And that's why they're based on a regional structure, is so that they can be deeply embedded within the community, know what is available, while also simultaneously being attached to the state government and to OHA, and to Lines for Life and other statewide actors, non-governmental actors in this space, in order to be able to help connect vertically all of these awesome things that are happening, because we are seeing across the state that there's amazing work happening in county public mental health or county public health, that there's amazing work happening at the state and incredible stuff happening over at OHA and in our private partners who are not-for-profit agencies. But in many cases, integrating those systems together has been challenging, because when you work in a school, your job is to help kids all day. It is not to reach out and call every community-based organization that provides mental health supports. And oftentimes there isn't someone in a district or an ESD who's available to spend the time to make those connections. And so our hope is that we can help provide these individuals as having both the training to have the expertise to support you directly, as well as having the relationships locally and across the state that will help support accessing the resources that are necessary to implement a comprehensive suicide prevention, intervention, and postvention programming. And before I move on, does anybody have any questions about the 11 ESD-based specialists?
Maybe just a quick question to see if anybody has heard about them. Is there any hands raised that have heard of this position?
We actually had ours present to our K-12 counseling meeting in January, and it was really great, I think, for our counselors to make that connection and to meet the regional coordinator for Washington County. So if people haven't done that, I think that was really helpful, and just introducing and then also to make that connection.
That's a great idea. Thank you.
Absolutely. That is so good to hear.
I know that this
are some exciting opportunities to meet them coming up, but the rest of the specialists are still kind of getting up to speed so that they will be able to do that. But that is one of our big goals going forward.
I've been in touch with ours, just, having her kind of review our updated suicide prevention intervention post-mention plan. She's coordinating professional development for assist training with our district. So she's immediately been helping us continue to move forward.
Michael, were you going to add something? I thought I started to hear you talk.
Yeah, I was just gonna say, I know that this feels like this was a long time coming, and I know it didn't make it through legislature the last time, and so I hadn't heard that we're this far along yet, though. So to answer the question, I knew it probably was coming, but I didn't know that where we were with it. So this is very exciting.
Great, thank you. Is there any other questions from anyone?
Glad to hear that you guys are excited.
Is there a list where we can find our person and their contact information easily?
Not easily currently, unfortunately. That's something that we are working towards. But if you want to shoot me an email, I'm going to pop my email in the chat. I will get you connected with whoever your person is.
We might already be connected, but just for my own, just in case, what if we're not? I'd like to be able to see who that is and ask the right people.
Yes.
Thank you.
And that is one of our big goals. We're in the middle of working on our website right now. We're going to be doing another big update where we will, now that we finally have all of the positions hired and they are finally about to be finished with their training, so that everyone will be able to reach out, because not all of our staff are fully trained to be able to be doing reach out at this point. We are hoping that it will be much more accessible publicly by the end of the spring or early summer, because really this year has been a kind of get everybody up and running year, with the hope that next year they will be able to be a really beneficial resource to folks without being pulled by ODE for training and being unavailable on a regular basis due to that.
Kara, I have a quick question. Would it be helpful as part of your training and onboarding for these positions to have this group of contacts, because they're the point of contact in districts who, I mentioned before, are probably implementing or leading this work. So maybe we could help kind of bridge them as like one of the first people that they connect with in districts, if possible.
I think that's brilliant, Beth, and I think our specialists would be thrilled to have that information. Yes.
Yep, I'll share that contact. If everybody's okay with that, I'll share your contact information with the people in those positions to connect with you. Great, thank you.
Hi, this is Teresa Dowdy, and I'm just double checking because I see the map. I joined a little late. I had some kids that I was helping with a few things, but so is Union County, is that just all lumped into Intermountain, like that whole big broad area? Is that how, because I don't see Union County listed, but I see under Intermountain, that's just a pretty big region. Is that correct?
That is correct. So the initial funding didn't allow for specialists based at every ESD. So that's why we have contractual required relationships. So Intermountain does cover Union.
Looks like there's a question.
Okay, thank you.
Thanks, Teresa, for your question. There's another question in the chat from Roberto about Wallow Grant separation from the other Intermountain areas.
I am not sure why those decisions were made, to be perfectly honest. That occurred before I joined, but I could definitely reach out to the person who would be knowledgeable about that and get that information back to Beth so she could share it with you.
I can probably tell you. So at one time we had our own ESD in Union County. So it was Union and Wallowa, and I think Malheur County, it covered like Baker. And then when they had the fallout of the IMES, not the IMESD, the ESD in Union and Wallowa County, maybe even Baker County and Malheur, we had to go somewhere to a different IMSD. So LeGrand and like Imbler and Elgin and Cove and all of those joined the IMESD. And then I don't know who Wallowa County is using. That's why I thought it was kind of odd. They must have their own. And then Grant and Wallowa must be their own county. So the Union IMESD dissolved several years ago. And then we just had to be absorbed in some of the other ESDs for our region, Roberto.
Well, thank you.
That makes sense. Teresa, thank you. Glad you could join us.
Yeah. So not to add confusion to this, but there is also another set of positions that are funded through Section 36 of the SSA, and they are not ESD-based positions or ODE-based positions, but instead, they are positions based in Lines for Life, which is the nationwide and statewide suicide prevention and postvention advocacy organization and also service provider. And so Lines for Life has been funded through an agreement with OHA for 4 suicide prevention and wellness coordinators and a school suicide prevention and wellness program manager. And so they're splitting up the state basically into quarters where it's, northwest, southwest, southeast, northeast, and they are specifically solely trained in school suicide prevention, postvention, and intervention. So while the specialists are kind of the overarching aspect, and you need to connect with a specialist to connect with Lines for Life, or the idea is that you should connect with a specialist to connect with Lines for Life, they are a much more targeted set of skills, because the school safety and prevention system specialists, again, focus on all school culture and climate and a huge broad range of student need, because we recognize that mental health and student wellness are deeply connected to a broader set of structures. But we also recognize there's a specific set of expertise related to suicide prevention, intervention, and postvention. And so the Lines for Life staff are available to help provide those supports. And so they are an additional set of staff that offer the access to trainings, review of Addie's Act plans. They have the step-by-step guide, which is, and will help support the development of an Addie's Act plan using their step-by-step guide as well. And then this year, unfortunately, this is over for the year at this point, but we're hoping to bring it back again next year. Lines for Life is seeking funding for it. We had a mini grant program where districts could get up to $1,500 to apply to the costs of staff or student training, curriculum, or any other cost associated with the implementation of school suicide prevention plans. So things like coverage, staff coverage, substitute time, those sorts of things were available to be funded. And we're hoping to bring that back next year so that we can continue to provide that financial support for the implementation of these plans. And then additionally, most of you are probably aware and are not needing, but Lines for Life also is providing a school suicide assessment hotline for schools that do not have a counselor or other individual who is trained on staff to be able to provide a school suicide assessment if there is a student safety need. That is another available resource that Lines for Life is offering for our districts that are having a more challenging time obtaining the necessary staff at all of their buildings to be able to implement these kinds of systems. So those are the 2 major sets of humans that we have that are available to help support this work, and hopefully to help support you in completing this work in ways that are locally meaningful and also centering equity in every aspect of the work. So looking ahead, this kind of brings us to our broader conversation. Given that we have these positions and we have this system that we are building, what would be beneficial for you all to be able to receive supports, services, trainings, what materials would be useful for the school safety and prevention system to provide to district schools to use specifically, so that when we're looking towards building our system and looking forward into the next year, how can we make sure that this system is designed to support the comprehensive school counseling programs in a way that is meaningful and helpful?